going to start the Health Commission Finance and Planning Committee meeting.
I'll take the roll. Commissioner Chung
Present.
and Commissioner Guillermo.
Present.
I will also read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. The second item on the agenda are the minutes of the June 4, 2024 committee meeting.
So I'll move to approve.
And I'll second. And
Is there any public comment in the room? There's only staff here. Any public comment from that one person who got permission to give remote public comment? I see no hands. So all those in favor?
aye.
Aye.
All right, thank you. The minutes are approved. We can move on to item 3, the monthly contracts report.
Hi, good afternoon. Michelle Ruggles, Director of the DPH Business Office. I'll go ahead and start with, if it's in this order, UC Bridge Clinic. And we have staff here to answer deeper questions that may not be answered sufficiently on this report. But the first one is UCSF Bridge Clinic. This is an amendment to an existing contract which you approved previously, but for a much smaller amount. And when you originally approved it, it was for a clinical champion program, which was a program grant funded that provided clinic champions to work in 7 emergency rooms across the city, helping to navigate and train, work with the ED staff on how to best navigate and work with people with substance abuse disorders that were showing up in the emergency department. The reason this has gotten so much bigger is that this is a request to add an amendment to reflect new grant funding that was added to this contract specifically to an opioid settlement funding to expand the hours of the UCSF Bridge Clinic itself. And what they used the funding to do was add hours, was to expand all the shifts, the day shifts, and add a weekend. Sorry, I don't want to mix it up with another contract, but that I know that's what they did. They used it to expand the hours. The new funding, the original grant funding ended. New grant funding supported the continuation of the Clinic Champion program, but the bulk of this money is the new funding to add the Bridge Clinic hours. And so those funds were awarded in March of, I guess last fiscal year, which is what caused the delay in getting this here. It was getting the money to the vendor, getting the contract documents back. But we did go back to the original date of the grant so that should they have had any like startup expenses, like getting posting for staffing, it could be reimbursed. But so that's why it's retroactive, and that, but it got added in March. So I'll leave it there if you have any questions that I can answer, or the staff from the clinic, from the department.
Thank you, Michelle. I have a couple questions. One, in the population under the description, it says, under the service description, it says that the training will support a group of ED based. So can we be more specific about the group?
Yeah, it's at 7 hospitals across the San Francisco. I don't know the names of the hospitals. Emily knows the names. Yeah, so she can.
And while she's coming up, just to note for the public, questions from the public or public comment is taken at the end of this report.
Hello, commissioners. So the question is, what were the specific locations and staff that are
It just says group. So it's like group of where, how many, how
Yeah.
they are selected? Yeah,
So what they do is they're working with all hospital-based emergency departments in San Francisco. So every single one, excluding the VA, although they are working to engage the VA in this work. And they identify a clinical champion, which is a provider level, so NP, PA, or physician, that is willing to participate in these work groups and attend on a regular basis. And then they also work to support a substance use navigator that is within one of these 7 EDs as well.
okay. And is there the seven, did you say 7 hospitals? It's
Mhm.
just, those are hospitals that have already been in the program.
Correct.
Okay. And then under UDC, it says 300. Could you just explain a little bit what that
Yeah,
is?
let me take a look just to remind myself what their UDC is defined as. Oh, it's the extra hours that they expanded the clinic.
Okay, all right. Thank you.
Anything else on Bridge?
I don't have any questions.
Okay, thank you.
Thank you.
Okay. The next contract is the San Francisco Study Center. This is an amendment to a contract agreement that is a program administration contract managed by our Behavioral Health Services JEDI section. And I'm totally justice, equity, diversity, and I apologize, I'm not high, under Jessica Brown. So this contract has been here, but this is a program administration contract, and it is designed to help that section to provide racial and health equity training for BHS staff, all levels of staffing in BHS workforce, from line staff to managers. They've added quite a bit of detail into the service description so that you're able to see the types of trainings that are being provided. And the vendor, San Francisco Study Center, receives an 11.1% indirect. So that's about 100,000 annually, with the rest going towards the direct services, the training. And you can see under service description that the program administration role is to manage some of the administrative functions on behalf of the department. So the subcontract management of the subcontractors, some capacity building, and some coordination.
So I had just a, I'm not sure if it's a typo or a term I don't understand. Under target population, it says the target population for the contract is both DPH staff and the borader. I don't know what that is.
Probably a typo, let me see. Where are you reading that? Which, it's under target population?
Yeah, page 2 of 9 on the report, right? Under target population
Oh, broader.
and the broader.
BHSF and the broader community to address a shortage of qualified individuals. So they're doing training for workforce development and then training of BHS staff.
So the broader community is who?
The broader community of people that serve clients that utilize the behavioral health service system.
So provider community?
Yeah.
then? Okay, maybe we should make sure that that change is made before we.
Okay.
So it's an expansion of the existing program,
Correct.
and that's why there's such a high annual difference as well?
Right. The annual difference the annual difference, they've expanded the level of training that they're able to provide, and then they're extending the term. So when it started, it was a smaller amount of 500,000.
Right, I get the extension of the term but the increase in the annual amount was something that I wasn't quite sure of.
Is someone here from JEDI?
Jessica Brown is on the phone. I mean, is on. Okay. Jessica, are you there? Jessica, I've unmuted you. Can you, Commissioner Guillermo was asking for the reason for the increase in the amount of money.
Just the annual
I'm sorry,
difference.
the annual.
The overall is understood by the length of the contract, but the change in the annual difference is, I don't know if I missed it, but I don't see where that difference comes from.
I can try to get that broken down. It wasn't broken down specifically just to the change. It was the whole, like, this is what we're providing, is what's provided in the detail service. But I'll get that for you.
Okay. I mean, it's great that there's so much detail on the service description, but I'm just wondering about the difference in the annual amount, whether that is equating to different programs or just an increase in the broader community that's being trained.
Okay.
Any other questions, commissioners, or comments? All right.
On to the next one.
Okay. Okay. The third contract is Richmond Area Multi-Services, Inc. This is a contract, sorry. This is wow. Okay, this is an amendment to an existing agreement. You have approved it. Let's see. This is a contract that just went out to bid and it's continuing existing services. And what it's doing is bringing clinical positions that are under RAMS who are going to support the department's best neighborhood team, which is under behavioral health services. And so they're helping in the street response, and that's the role of this contract. They also, yeah.
Just the same question about what explains the change in the annual difference. It's again, a
The
significant amount.
annual difference, I think, is just because it was annualized. The original contract wasn't for a full year. And so this is getting this contract in, and so that's the difference.
Okay, so if it wasn't annualized, why is there an amount that says the prior annual?
Well, what we do in that box just for comparison purposes is show what we paid them last year. So you have a point of
Okay.
reference. And so since it wasn't a full year, that was just the point of reference, which should have been noted, but yeah.
Okay, thank you.
Commissioner Chung, any questions, or is it okay to move on?
No, I don't have any.
Okay, thank you. Ms. Ruggles, we can move on.
The next contract is called HTL 587. This is a new contract for continuing services. This was previously in a contract, and then it was put out to bid. This is a contract that provides hotel rooms that are used by individuals who are served by the department's managed alcohol program. So this vendor is providing the rooms. Community Forward San Francisco is a nonprofit provider. They provide the like the operations, the front desk, and then it's our own DPH staff under whole person integrated care that provides the clinical team, which provides the services. So this is a one-year contract, and it is funding those beds, and then it's also providing access to additional beds should we need them for isolation. It started actually the original contract as a COVID response. And anyway, so that's why that's there in case we need to have quick access to isolation rooms. But we're not paying for those unless we use them. And then, but anyway, that.
No questions?
Yeah, no questions.
Okay. The next set, I'll just mention them and then I'll turn it over to Baljit Sangha from the San Francisco Health Network. And he'll speak to these, but essentially we have a set of nursing temp registry contracts. And there's a primary and then there's the backup contractors. And this just came off of a new solicitation. And I will turn it right over.
Good afternoon, Commissioners. Before I jump in and say anything, I'll have to take any questions that you may have off the cuff, or I can jump into a couple of things I would like to highlight for you.
I think you can go ahead.
Okay, great. So, so the registry contracts, we're excited to present these to you today. There's 4 sets of contracts, and that's mainly because at any given time, some in the ecosystem that is the regional Bay Area, there may be competition for the nursing registry. So we want to make sure we're in an abundance of caution. We have a primary, a backup to the backup, and then a backup to those backups. The main focus here that really surrounds and encapsulates these particular contracts is just our continued focus as a department to hiring our additional permanent RNs, making sure we improve our retention and having less requests for leaves, and just also making sure we just keep track on how we're managing our ebbs and flows in terms of volumes. For example, in wintertime, when you have a kind of a more of a tougher respiratory season. Now, one of the things about this in terms of how are we going to track this? How are we going to monitor it? How are we going to stay on top of the spend and what I just shared? With our new chief nursing officer, our inaugural role that is being filled by Troy Williams, there are a few things that Troy and the DPH team have put into place. One is daily reports on how we're utilizing these nursing registries, monthly meetings with nursing leadership and our finance colleagues just to make sure that our spend and our trending are in line with what we're anticipating. Monthly meetings with our union partners as well. So we're very transparent and open in terms of what are the drivers for the utilization and what are we doing about them, and making sure we can also hear any additional feedback on how we can really monitor that. Finally, that's more the internal piece. Those feed into then the quarterly business reviews. Now, the QBRs are just a standard best practice that we want to have with any of our major vendors in any series or any kind of service. Now, the QBRs themselves would then allow us to keep track with the vendor to monitor their performance. How often have we asked for a particular type of classification or a nurse or anyone in the registry, and how often have they been able to fill them? Not only that, how quick were they able to fill them? And not only that, how are they been onboarded and making sure that they're fulfilling their obligations related to making sure they meet our standards as a Department of Public Health, both just our internal DPH guidelines, but also the regulatory guidelines that govern nursing and nursing registries. The last thing I'd like to highlight is that we really proud of our contracts team and under the leadership of Troy Williams that we're able to go back and really negotiate some really competitive rates. Some numbers I'd like to share with you is previously for specialty nurses, we were being charged $125 an hour. In this particular, in these contracts, you'll see it's $102 an hour. That's an 18% reduction. We also similarly, when it comes to non-specialty RNs, we were able to reduce it by 20% from $110 an hour down to $88 an hour. And the last one I'd like to highlight is for LVNs. We were able to go from $80 an hour down to $60, and that's a 25% reduction. So we're incredibly happy that we're able to embrace our fiduciary responsibility and at the same time continue to meet the standards of our patient care. That's really at the center of what we're doing. So I'll stop there, but happy to take any questions or any feedback from you.
I had a question. So when you have these quarterly business reviews, are you also able to review, because you mentioned the competition for registry nurses between our network and other hospitals, are you able to sort of review any impact that the demand from other hospitals or outside of the network impacts our network?
Yes. So the answer is yes. 2 ways, both with just looking at the turnaround time for when we submit a request to these companies and when they're able to fill it, meaning we have boots on the ground of an individual. Separately, one of the major goals for our chief nursing officer for Troy and the leadership team comprised of all the other CNOs in the health network are to really create some additional linkages and connections with other CNOs in the region, not just within DPH, but Sutter, Common Spirit, Dignity Health, Kaiser, to also have an additional conversation stream to just talk about what are you seeing, right? How do we make sure we're talking to each other in addition to the conversations with the vendor, which I think collectively then we converge on kind of what's, what the reality is of the competition in the system and how we can also potentially anticipate things in advance. So we're not just kind of caught off guard and having to backpedal.
Thank you. And then given that overall, I guess we're trying to improve the number and the rate at which we hire our own nursing, and also acknowledging the continuing need and the competition, again, in terms of being able to win, the hires over from other potential offers. Is that something that also sort of comes into consideration? We're trying to reduce the number of registry, but at the same time, the sort of our ability to hire is not necessarily all under our control, even though we're trying to improve it. So I don't know if that has anything at this point in terms of the consideration in these contracts.
Commissioner, can I just for some context, I mean, in terms of winning, we are winning this. Just to remind the commissioners, as of June 30th, we basically had filled our nursing vacancies. So we went from 12% to virtually 0% vacancies. So that's remarkable. The other thing is that our retention rate is above the industry standard. So, the DPH nurses, the tenure of DPH nurses is higher than the industry standard. At the same time, we need these contracts for flexibility, as you understand, but I just want to make sure that, and Baljeet will add more, but the bottom line is we've made tremendous progress on our hiring our vacancies. Vacancies as of June 30th were basically 0. That will go up a little bit now July 1st because of retirements, just to be clear about that. But both hiring and retention are very high right now.
Well, congratulations on that. I mean, that's something that we should all be.
Well, it's a phenomenal partnership with our human resources colleagues and with the operations team and the CNOs across the network. I mean, that just really encapsulates and really captures, we're not just trying to be reactive anymore, but what we've made some ground. Yes, we have some retirements and some net new additional FTEs in the budget, but now being in a place where we can proactively start to anticipate these. And I think, the future is looking really bright in terms of how we're going to keep these positions filled, but also then monitor our fiduciary responsibility and making sure our union colleagues are with us every step of the way as we're working through this. So we're really excited about what this year will bring.
Great. So this really is contingency upon contingency upon contingency.
Yeah, absolutely. Yeah. And you'll know it's for 1 year, but that's because of, it's coterminous with the Civil Service Commission's authority that was given to us. And so we hope to then in the upcoming year, again, go out to RFP. So we're maintaining our competitive advantage in the market to see what the market is showing versus locking into rates for 2 or 3 years at a time, because the industry changes much faster than that.
Okay, great. Thank you very much.
Yeah, of course.
All right, any other questions? Seeing none?
There was, let me go back to the member of the public. I did see a hand on
Okay.
member of the public. Mr. Manette Shaw, would you like to make a comment on this item? I saw your hand earlier before the commissioners go to vote. All right, I see no hand at this point.
Okay, so entertain a motion to add this contract report to the consent calendar for approval.
A motion to recommend approval, but with those clarifications and grammar change or spelling changes. Yeah, okay.
But my understanding is it was just it was the one contract where you needed to know about the annual amount because Ms. Ruggles gave the other and just the correction on the, okay,
Right.
wonderful. Thank you. Great. All those in favor?
Aye.
Wonderful. It will be put on the consent calendar. We can move on to item 4, request for approval of a new professional services agreement with the Gubbio project.
Hi, Commissioners. My name is Emily Ragnold. I'm the Overdose Prevention Quality and Contracts Manager within the Office of Overdose Prevention within Behavioral Health Services. Today, I'm seeking your approval of a new professional service agreement with the Gubbio Project to provide a daytime safe sleeping and drop-in site. The total proposed agreement amount is $5,264,000, which includes a 12% contingency for the term of July 15th, 2024 to June 30th, 2026. The Gubbio Project has been operating a drop-in site at St. John's the Evangelist in the Mission neighborhood for the last 5 years. With this funding, they'll be expanding their services. They're currently operating 7 a.m. to 2 p.m. Monday through Friday. And then with this funding over the course of the next year, they'll be expanding to Monday through Saturday from 6 a.m. to 9 p.m. The program will be serving 50 to 150 people experiencing homelessness per day, and will have 45 beds available for people to rest. Additional services that they will offer is a courtyard cafe where folks can come and relax in a garden and receive hospitality services, referrals to other services. They'll also perform community outreach in the neighborhood to bring participants off the street and into this program and ensure that the surrounding area around the program is kept clean and safe. They'll also be distributing naloxone or Narcan and doing substance use education and navigation to treatment, like withdrawal management and residential treatment. And overall, will maintain a safe and clean and quiet guest environment. This is a really important part of our system of care, as it serves as an entry point for many people in accessing treatment. And they also serve as a drop-off location for many crisis intervention teams in the city. Any questions that you might have?
Just a quick one. Do we know how long has the Gubbio Project been providing these services? Not under I mean, since this is a new contract for us, but
They've been
general.
providing these services at a smaller scale for the last 5 years.
I actually have a question because I see there's the emphasis on the word clean multiple times, but it didn't sound like they offer showers to.
They do not have showers at this time. I believe they're looking at the infrastructure to build that up. The clean is really focused on maintaining a good relationship with neighborhoods in the area so that this program does not have any negative impacts on the community.
Okay, all right, so that makes better sense then.
Yes.
Thank you. Do we have a motion to add this to consent calendar?
I'll move recommendation of approval.
Thank you.
Thank you.
Well, and all those in favor?
Aye.
Aye.
All right, great. Thank you. No, that's good. Just have to close that loop. Thank you. Item 5 is request for approval of a new agreement with NetSmart Technologies Incorporated.
Hi, good afternoon, Commissioners. This is for the renewal of the NetSmart contract. NetSmart is our vendor for our behavioral health electronic health record system. As you may know, mental health moved over to Epic on May 22nd of this year, but Avatar, the product that NetSmart provides, will still be used for substance use in our private provider network. And this contract is for 3 years.
Any
So-
questions?
Yes.
Yeah, so we will continue to use Avatar, you mean?
Yeah, we will continue to use Avatar right now for substance use and also for the private provider network. The private provider network is slated to move over to Epic as well. Don't quite have a date for that yet, but it is part of the optimization.
Okay, so this is in transition. It's not like-
Substance use, and I have Kelly here if you have any questions regarding substance use.
Okay,
Kelly Hom is the Director of Substance Use Services, and we can answer some questions a little bit about the substance use piece.
And Commissioners, if you recall, when Dr. Kunins came, she explained that the substance use services cannot be put into Epic due to legal reasons. That's why there's avatars maintained.
okay, so I thought that would be like have some firewall in the same system, but I guess wrong.
There are new developments, Commissioners. There has been new guidance issued forth by DHCS regarding 42 CFR that may give us more opportunities to implement EPIC at some point. We still have to have a contingency plan, so that allowing us to move to 42 CFR allows us to implement something called universal consent. We are, for those clients who sign the universal consent, we're all good and everybody can be in Epic and it's perfect. For those clients who decline to sign the universal consent, we do need a contingency plan. So, and anyways, we're not ready to move anybody to Epic because it takes time, it takes planning. And so for these 3 years, we are going to continue to need Avatar.
Okay.
And this is a new contract because the existing contract is
Yes,
expiring?
Just
So it's a sort of a continuation of the,
Yes.
okay.
Okay. Thank you. It's just that Avatar's been used for so long. I didn't know there are any like breakthrough technology, so that's why I'm asking. Yeah,
Do you have any other questions for us? Okay, thank you so much.
thank you.
So I'll move recommendation of approval.
And can we have a second?
Second.
And all those in favor?
Aye.
Thank you. Item 6 is a request for approval of a new professional services agreement with Health Management Associates, and this is the BHS contract.
Good afternoon, Commissioners, Dr. Colfax and Mr. Morwitz. Yes, I'm here to discuss Program 1 that you see described, whereby I'm asking for approval of the contract with the HMA to provide services to further develop and our substance use disorder and severe mental illness crisis and street interventions. So whereby HMA would consult with us and they would provide facilitation of focus groups, develop workflows, work plans, working with BHS, the San Francisco Police Department, Department of Emergency Management Services, and other city agencies that are involved in these efforts and in bringing services to people with substance use disorder and severe mental illness. As you can see, HMA is a group we've worked with since 2017, and they have both local and national expertise in behavioral health and meeting the needs of this community.
So the first project, the multidisciplinary team are we supporting the totality of their work, even though it's multidisciplinary? The other departments are not sharing the cost. It's because it's primarily for our benefit. I'm not, if you can just sort of explain that a little bit. Yeah.
Yeah, it's a good question. So yeah, behavioral health is, DPH is asking for these funds whereby we would be the drivers working with our city partners. So already, for example, with SORT, we're working with the fire department. And so really harnessing all of these efforts and leading them. And so that's correct. We are would be the drivers and we would be footing the bill.
Okay. So that's what I wanted to clarify when we're footing the bill, that we get to be the
Yes.
sort of the lead and the center
Correct.
for this. So, okay, great. Thank you.
Okay. Any other questions? If none, can we have a motion for this first contract?
Sure. I recommend, I move to recommend approval.
Okay, I second.
And all those in favor?
Aye.
Thank you so much. Item 7 is request for approval of a new professional services agreement with Health Management Associates. Second one today.
Hello, sir.
Good afternoon again, Commissioners. So before you is another HMA contract, but the scope of this particular contract is related and tethered to sustaining our recertification at Laguna Honda. HMA, as you recall, in our last full Health Commission meeting, there was a sustainability presentation presented just around how we plan on moving forward with Laguna Honda Hospital and Rehabilitation Center and ensuring that we continue to maintain the gains and also grow even further. part of that presentation included references to expertise and skilled nursing facility experts. And so HMA is one of those individuals or the entities that we have chosen to leverage their expertise to help us move forward in this coming year, as well as for really using this year as a barometer for any resources we may need moving forward. This, coupled with our new leadership teams that are coming into place and really hitting the ground running, learning the operation, building on the gains of the past couple of years, we really are looking to leverage the HMA expertise here to support that. The one main thing I'd like to highlight is, as you know, Laguna Honda Hospital has our 769 skilled nursing facility beds, but then we also have 11 acute beds, which are certainly very critical to the whole operation. HMA also brings to the table expertise around acute care. And that's one thing I want to make sure that the acute care operation in the setting that is Laguna Honda continues to be an area of focus for us. It is just as heavily regulated as the SNF side of the operation, requiring annual surveys as well, both from CDPH and CMS. So this contract before you is really meant to continue to provide that scaffolding and that support as we move forward into the coming year. And we certainly have been building upon the work that HMA has done in the past couple of years with us to help influence just this not to exceed amount. Our goal is not to leverage this entire amount, but we also know that we've leveraged, as you can tell in the summary sheet, there are different categorizations of different types of roles that we have leaned upon. And we know that we want to make sure we have those variety of hours and those different hourly rates, because it's critical to just not have one roll up. We may not need the highest billed hourly rate when you might need just an analyst or a project manager or someone to help us look through what we're looking at for survey readiness. So I'll stop there, but happy to take any clarifying questions or any questions you may have.
I'm sorry, and actually there's public comment on this item.
Okay.
Let's see. Mr. Minutchaw, I put 3 minutes on the clock. Are you there?
Thank you, yes.
Okay, please begin.
Wait a minute. No. Hold on, Mark. My audio stopped playing for some reason.
You can always submit written comment, Mr. Minutchaw.
Oh, crap. All right, thank you.
Okay, bye-bye.
So I had a question. So in terms of then accessing the different expertise that's enumerated here, how will that be determined and who will be determining that?
So that will be in partnership. So as we're looking to then have a structured stand down of our incident command structure, of which I'm a co-incident commander with Troy Williams and Roland Pickens as our executive sponsor, that combined with the new leadership team under the leadership of Sandra Simon and our ANHAs, as we look to identify what plans of correction elements that we have committed to in previous plans of corrections that we need to sustain, but have not yet feel like we're in a place to step away entirely, that's what we'll figure out, is there a gap there? And if there's a gap there, what can vendors such as HMA provide? Is there an expertise related to, for example, acute care preparedness with the level and length of stay that we have that we need to keep track of? Or is there any kind of additional opportunities we know we have that we can not learn the hard way, but come in with somewhat such as mock surveys, other things like that. And mock surveys, which we realized the benefit of early on in our decertification journey, which are conducted by HMA.
So would an example also be in the case of some survey findings and plans of correction that need to be developed in terms of those survey findings, if there is some expertise that's needed in terms of developing those plans of corrections, or anything? Is that another example of where?
That's accurate, yeah. So we could, plans of corrections, particularly in these settings, we want to get it right, the first time, and we want to make sure that it's evidence-based, it's grounded in some best practices. HMA and their breadth of expertise allows us to do just that based on their footprint nationally. And so what you described is spot on in terms of how we would dig into that opportunity. And then with the appropriate level of, I guess, line item of the correct skill set. So make sure it's balanced in terms of what we need and not too much and also not too less.
And then I don't know if there are other facilities that have both SNF and acute licenses together. Do they have expertise in being able, I mean, you mentioned that they have expertise separately in those areas, but do you know of any other instances where, both acute beds and SNF beds are together in one facility and HMA has some experience in being able to sort of guide?
Yeah, well, absolutely. They do exist in the country. I know just across the Bay here in Alameda County, Alameda Health System also has a similar model. And so we've created some partnerships and linkages over the last couple of years. But beyond just the Bay Area, our goal is to really align our practices with kind of just national standards. I think that's the one thing we've realized in our whole journey, that we want to make sure we are visible and we're out and we're engaged with the national community in this regard versus just kind of more of a localized footprint.
And then in terms of being able to assess whether there's a balance in terms of accessing the expertise, that's going to be done sort of with the executive management within Laguna Honda as opposed to just a single person determining that. Okay.
Absolutely. I mean, in our in the previous item, I was able to discuss with you before that embracing the fiduciary responsibility that we have. We want to make sure that the resources that we are utilizing actually are indeed going to bring value add, especially since we've also been investing in our leadership to have that SNF expertise as well. So we want to marry it up where everyone is moving forward successfully and not pulling away or withdrawing some resources or expertise too prematurely. But our goal is to be diligent in how we access this.
And just last question. So HMA was chosen from a competitive bid process. Is that correct? Okay, great. Well, I'm glad to hear that we've been able to retain the kind of expertise that we believe that we need, and look forward to hearing more about what role they play and how it's improving, as you say, our own sort of internal in terms of the goal that we have of really sort of being the model and being the best at what we do.
Absolutely.
Thank you.
And as future items come before you, we'll make sure we tether them and orient them all collectively to the plan moving forward, so it does feel like a coherent strategy that you're hearing and aligns with what you've heard before.
Thank you.
So I have a couple of questions here. So the first question is, looking at the address, it's the zip code is Michigan. Is it Michigan or Missouri?
Or, yeah, the address of the company, correct?
Yeah. So because it says that they have 30 locations, so I was wondering if any of their locations are closer to California than Michigan.
That, at the risk of hypothesizing, I will say that it's likely that maybe a main corporate office. I can confidently say that we have had discussions with the team here in San Francisco. There is a footprint here at a San Francisco office, as we discussed our strategy when we were in the nascent stages of recertification. So I do know that they're definitely local. I would say just within a couple miles from where we are now, but this may actually I want to say could be their corporate office.
Okay, so that's more of a relief for me, so that we don't always import consultants, to do local works, and that we actually utilize local consultants as well.
Absolutely.
Okay, so thank you.
So I will move to recommend approval to the full commission.
I second.
And all those in favor?
Aye.
All right, thank you so much. We can move on to emerging issues. Let's see, I see a hand from the public. I'll just check in. Mr. Minichal, would you like to make comment on this item? Emerging issues?
No, but thank you, Mark. I'm really disappointed. My computer audio was working within the last hour. I don't know what the hell happened.
All right, well, good luck with that, Mr. Minichal. Thank you. All right, and then based on that comment, I see there's no public comment. And commissioners, please consider a motion for adjournment.
Move to adjourn.
Second.
Are all those in favor?
Aye.
Thank you, everyone.